Hey, boo.
Hi, girl.
Hey,
How are
girl.
you?
I'm good. You look cute.
Thank you. You too. Hey, everybody. You want to give them maybe 2 or 3 minutes and then get started?
Yeah, let's do that. A lot of people are hopping on already. Thank y'all for being on time. I love it.
Ready? How are you?
I'm good.
Good. You popping over there, girl.
You know, I try.
I want y'all to see my shirt a little bit better.
I know. I didn't realize that when it was a half screen, it would cut off a little
cute
bit. Cute
shirt on, and no one can see it. Okay, so
let's get started.
Yeah, let's just do this. And we'll have the live footage for anybody who comes on late. If you missed something, don't worry, we'll be able to give you some coverage later. So I just want to start by saying that tonight's conversation will be brought to you by Shelly, which is in her brand, which is God's Favorite Homegirls, which is an amazing brand with our cute shirts. So
beautiful shirts.
Thank you, Shelly, for having us, and we really appreciate your support to healthcare workers and your movement and everything that you're trying to do for women in business and just women in general to keep us empowered through this trying time. So God's Favorite Homegirl was created to highlight women that are God-fearing and women that are climbing the ladder to success while keeping their faith strong. In trying times, you want to be sure that your faith does not waver. And so that's very important when we're facing this pandemic. So we want to just kind of talk to you guys about some of our experiences and kind of just talk to you in general about COVID-19. We're just going to start with an introduction so you can kind of know who I am and you can be my bestie, and then we'll kind of jump right into it. So I'm Amber Young. I am a perioperative services nurse, and I actually travel, so I float between different outpatient facilities. And so that's pretty much my background, and so that's pretty much me. So now I'm going to turn it over to my bestie.
Hey, everybody. Thank y'all for joining us. I know Amber already did, but I do want to shout out Shelly and God's Favorite Homegirl for these amazing TIFF tees that we have on. My name is Regina Bissett. I go by Dr. Richie. I'm an emergency medicine physician in Houston, Texas. I work in one of the largest medical centers in the world. I also happen to be a hospital administrator, so I'm responsible for running the emergency department of one of the busiest level 1 trauma centers in the city of Houston. And with that being said, we kind of want to give you guys a little bit of background on coronavirus, COVID-19, so that we're all on the same page. We make sure that you all understand what's going on and understand what's to come. First, the Georgia governor announced that they would be reopening last week. Then the Texas governor announced that we would be reopening tomorrow. Now today, the Florida governor announced they're reopening on Monday. So there's a lot happening, and we want to make sure that above everything else, we're doing our part to make sure that our community is educated and we know what to do to protect ourselves, because it's us or else, right?
Right. And we're all Amber, together.
Tell us a little bit about kind of how this has changed your workflow and what you're kind of seeing in the surgical center that you work in.
So to be completely honest with you, in the beginning, I feel like we weren't as prepared as we could have been. So initially, I felt like we were on more of a mentality of adapting as we were going along. So we weren't initially like, okay, COVID is coming, let's do X, Y, and Z. Although we had the supplies already, we weren't really too stressed about having that. We still didn't really implement our plan in which way we could move forward. So now, since we had kind of reality hit us a little bit harder than I think they anticipated, we've implemented a lot of new things. So to start, we are screening people at the door, checking temperatures, seeing if they've been around anyone that's been exposed. We're also asking them if they've had symptoms. We're also looking for symptoms, and just kind of trying to screen prior. We also screen all employees. We are requiring that everyone wears a surgical mask in the waiting room. We are encouraging visitors to go to their cars and wait for their family members. And all staff are required to wear an N95 mask and a surgical mask. And if you aren't necessarily in the clinical area, they are at least at a minimum have to wear a surgical mask. So I do feel like we're a lot more prepared. We aren't really struggling with the supplies. So moving forward, we are in a position where we can kind of be successful.
So preparation has been a really, really big part of this. I think when things first kind of jumped off over in Wuhan, China, that's the epicenter of where the pandemic started, everyone at first was like, oh, okay, well, that's them. And then it spread to the rest of Asia, and then it spread to the rest of Europe. And then January 20th of 2020, ironic date, we had our first case in the United States. And all of a sudden, everybody was worried because it had finally gotten to us.
Now,
And by that point, it was a little bit too late because a lot of the protective measures that we could have put in place, we didn't. And I think now what we're trying to do is trying to backtrack in order to fix the things that we should have implemented in the first place. So, you know, people are wondering, why do I have to wear masks? And, you know, I'm young and healthy, and this isn't a Black person disease, this isn't a young person disease, I'll be fine. Y'all, that is not the case. That is not true. There are 20-year-olds in my hospital on a ventilator. I have had to code a 30-something-year-old man, and he did not make it and was found later to be COVID positive. So this affects all of us. And although you may be young and healthy, your grandmas, your parents, your young children are not, and you don't know what kind of devastating effects this disease can have on them. So it benefits us all to do our part to make sure that we stop the spread. I've seen a lot going on social media recently. There was a house party in Chicago last week that looked super lit, but also super dangerous, okay? Ladies and gentlemen, just because outside is opening again does not mean that it's time to throw parties. It doesn't mean that it's time to just go back like everything is normal, because it's not. This is not just another flu, and I can't stress that enough. Most of us are old enough to remember the H1N1 or swine flu, as they call it, pandemic that happened in 2009, 2010. Just for comparison purposes, I want to say there were maybe 30 million people or so that got affected with swine flu, and of those, there were only 12,000 deaths, okay? There have been 1 million cases of coronavirus and 50,000 deaths. So if you figure out what the effective death rate is, coronavirus is about 6 times more deadly than what swine flu was, and it's about 60 times more deadly than the general flu. This is not just a normal everyday illness, and we have to do our parts to be safe.
And I also just want to kind of piggyback on what you said. I think the bigger picture that a lot of people are missing is that there is that asymptomatic patient that is walking around and doesn't show you symptoms. They could be at your house, they could be at your party, they could be at the grocery store, and they can have a really large impact on you, your family, and even your job. And I think that what people really forget is that healthcare workers are essential people, but we're also humans. So in order for us to really effectively protect you, we have to protect ourselves, which means we protect our families in order for us to have the energy to protect you. So with that being said, I think that also outside of it being asymptomatic, it's very important that you tell your healthcare provider what you're actually experiencing. You have to be very truthful about what's happening, because if we're dealing with the unknown, we don't really know what we're facing, and we can't move forward with that. And so it's very important that you take these guidelines serious. So quarantine is not really meaning chill with the people you know that's in your circle. No, quarantine means chill with the people in your household. And if the people in your household are infected, you have to separate yourself from them as well. So even though we love outside, inside has to be the new outside until this is controlled, or outside will never be the same again. So it's important that you kind of take preventative measures. So if you want to have a party, you have an event, you have different things scheduled. Everybody has something that's important to them, whether it's a birthday, an anniversary, a wedding. Those things still can go on. Virtual weddings are happening, virtual parties are happening. So you don't have to miss life's most important events. You just have to go about doing those things differently. So it's very, very important that you take the guidelines serious, because if you don't and you go out and you're impacted by the asymptomatic person, it hurts more than just you. It hurts people around you. It hurts your community. It has a large impact on everybody. So if we're in this together, we have to fight together and keep the standards the same and follow the guidelines together.
You made a very important comment about people who are asymptomatic, and that's a little bit of a big word, but for those who don't know what it means, it basically means that you don't show any symptoms. And yes, there are people that have COVID-19 that don't show any symptoms. What's even scarier is that the current data is showing that there are about 30 to 40% of people who don't have any symptoms. So that means in a room full of 10 people, there might be 4 people who look perfectly fine, have no cough, no fever, no nothing, and they're still infecting others, okay? So that's why those preventative measures that we're talking about are so important. The most important thing that you can do is wash your hands. Please be clean. Get a little miniature bottle of hand sanitizer, keep it in your purse, keep one in the car, keep it in your pocket. Use it anytime you touch what we call high touch surfaces. So buttons, doorknobs, your cell phone, because cell phones do hold germs and they're dirty and we're on them all day. Wash your hands.
All the time. You're on your phone right now. Go clean it right after this.
Wipe it down with an alcohol pad, put it in a baggie if you're at work and you know you're reaching for your phone all the time. That's something else that I've seen people in the hospital do. The other thing that's kind of making waves all over social media, I see people making their own homemade masks, either sewing the masks. I saw a cool little video on, I think, the Shade Room with somebody making a mask out of a sock. I was like, oh, okay, I need to save this just in case.
Yeah, they have a boxing bra mask.
Yes. Wear a mask when you guys go out. Wearing a mask is helpful in 2 different ways. So it protects me from catching something, but if I'm one of those 30 to 40% of people that aren't showing symptoms, it also prevents me from spreading it to anyone else. So a mask is helpful for me. It's helpful for everyone else in the community. And I really don't think, you know, some people are like, oh, this is weird. It's not cool. You know, I don't look fancy with my mask on. Okay, well, would you rather be lit or be dead? Because I don't know.
And then the thing too about being clean, I see a lot of people, wearing gloves everywhere. So let's just talk about gloves a little bit. If you drive with the gloves, get out the car, open the door, go get the grocery basket, go get the groceries, get the apples, get the bacon, go to the freezer door, swipe your card, and touch your groceries, the gloves aren't clean anymore. If you go to the bathroom with the gloves on, the gloves aren't clean anymore. So you have to let the gloves go and realize that washing your hands is most important. If you have hand sanitizer, like Regina said, put it on your purse, attach it to your grocery bag, whatever you have to do. Wash your hands, stop by the bathroom, use the soap and water, but stop using the gloves because the gloves are not making things better. It's actually making your wrist worse.
Y'all, we try not to be judgmental. We're not here to judge you.
Right.
But if I see you in public with gloves on, I might. So.
Right, especially if you touch. And then really, I see a lot of people in the grocery store, like, not really implementing the 6 feet rule. Okay, so look, if there's tape on the floor, that means that's your spot. If the person in front of you hasn't moved from their spot, don't move up on them. 6 feet is important because if they cough, if they sneeze, and you're right up on them, you have no protection. So, and it's like, it's not cool. I mean, this is the time to really honor people's personal space and learn to value yours as well. So I just think, please let the gloves go. Please wash your hands and just keep your distance from people.
So I know we touched a little bit on the fact that a few states are starting to open up. I will say that for myself in the emergency department and a lot of healthcare colleagues, a lot of my colleagues in the ICUs and other places, we are nervous, y'all. We are very, very scared on what's to come. We've seen how coronavirus has basically decimated the city of New York. I don't think y'all understand what they are going through up there. They're having 500 deaths in a day, in one day. My emergency department doesn't even see 500 people in a day, but they have 500 people dying in a single day.
And they have bodies in the trucks. Like, U-Haul trucks are full of dead bodies. Like, it's lots and lots and lots of trucks full of lots of bodies.
It's really, really serious out here. And, you know, I understand it. I think that the economy has taken a huge hit because of this. And, of course, no amount of money is worth a life, but at the same time, a lot of us can't really relate to that struggle, because I can't personally say that I know what it feels like not to be able to feed my family, and I can't say that I know what it feels like not to be able to pay my bills. So I can't sit in a position and judge someone who is eager to get back to work and eager to get back to doing what they need to do in order to be productive. What our goal is to teach you how to do that safely, okay? So if you have to go to work, the things that we've discussed are going to be extra important for you. Washing your hands, wearing a mask in public, making sure that you're staying 6 feet away from people when you have to go anywhere. And that includes an elevator. Elevators are not safe spaces. It's not a magic UV box where people can just pack in there and coronavirus isn't going to live. That's not how it goes. 2 people at a time on an elevator. If the elevator opens and you see that there are a lot of people on there, just wait a few more minutes and get on the next one. When you come home from work, your clothes can be contaminated. So what I do, and I'm a little bit extra, but I actually have 2 pairs of scrubs. I wear a pair of scrubs to work. Before I leave work, I change into clean scrubs. And then when I come home, at the door, I strip. Clothes, scrubs. I have a work wig that I wear. I take the wig off. Everything comes off at the door, because I don't want to bring any of those things into my family. So those are some tips that you guys can use as you start assimilating yourself back into society in order to try to be a little bit safer.
Right. And if you also have like family that's coming to visit, be sure that they take their shoes off before they enter their home. Have them disinfect their shoes. Even when you take your shoes off, disinfect your stuff. Like I have this Lysol laundry disinfectant that I actually use with my laundry to give me extra protection and be sure that my is a little more clean, which is probably a little bit extra, but I'm sure that it's clean. Also, if you have children, we realize that, some single parents and just parents in general can't keep their kids at home with them for the rest of the summer or all the way until next year. So it's very important when you're trying to put your child back in daycare to actually think of a couple of things. So as we discussed, we want to be sure that you teach your children how to wash their hands. If they aren't really involved in washing their hands, make it exciting, make it a game, have them count, teach them like something they could learn, or use something they're excited about to kind of help them learn to wash their hands. Like teach them games that require social distancing. There are things like kickball out there, and stuff that they could do outside that don't require them to be on top of their friends or right on top of you or like the teachers. We also are asking you to, use things that are disposable. If you have, the ability to get disposable items for your child, whether it's cups or whatever different things you can use, implement those things and buy them to kind of help prevent the spread of the germs. Because if the sippy cup stays cool all day, you bring it back and you don't clean it properly, then you could have a problem. Mm-hmm. We also say with your children, take their clothes off as soon as you get home. Like when you get in the garage or at the front door where it's a safe space to remove their clothes, take their clothes off, Lysol their shoes, clean their clothes in the same way that you would wash your clothes. If they have backpacks or if you have a purse, clean all those things that you don't usually think about, because your purse can carry germs, their backpack can carry germs. Wash their hands, of course, immediately when you get in there. Like make sure they wash good and wash them with soap. Like, not just water, wash with soap. Also disinfect any toys that they might have taken, and if they're stuffed animals, be sure you wash those. They require a little bit more than disinfectant wipes. Also they have like immune boosters out there that you can give your children that are natural, that can kind of help them kind of get a head start on preventing germs. And it's also very important that before you put your child back into daycare, that you ask the director, like, hey, what is your plan? Like, what have you guys implemented to try to prevent the spread of COVID? Like, what are we going to do differently moving forward? Because I want to be sure that my family's protected. Because your kid could also be the asymptomatic person, and then, you don't really think about it, and different things can happen.
Right.
So, we kind of just want to tell you about that too.
Knowing your options are going to be super important during this time. Aside from all of those great tips that Amber just gave about how to assimilate back into society, knowing what options you have if you choose not to assimilate back into society are important as well. I have a good friend that has an IG page. It's called Females with Funds, but it's not just for females. Men can get tips and advice from it too. And she goes into discussing how people with small businesses can apply for some of these federal grants and federal loans. to keep their businesses afloat. So if you're one of those people who don't feel comfortable opening your business and don't feel comfortable going back to work, there may be dollars available for you to help you continue to self-quarantine and stay safe. You know, people who are getting unemployment, you need to take a look at that, because if your job opens back up and you decide to say, you know what, I don't want to go back to work, I want to continue filing for unemployment, you may be in a little bit of a sticky situation because you likely will not qualify for unemployment anymore. If you choose not to go to work and your job facility is open and is telling you come back to work, you are not unemployed. So that's something important that people need to know that I don't think a lot of people do know. There are a lot of places that are giving out freebies, so to speak. One thing I will say about this pandemic is that it's really shown the humane side of our society. 𝐀𝐦𝐿 has been offering a lot of free childcare services for people who have to go back to work and maybe don't feel comfortable putting their child in a daycare. They may be able to offer you discounted babysitting services so that your child can stay home. Of course, you would have to screen the sitter that's coming in to stay with you. And, you know, there are just a lot of things available for people to kind of help bridge the gap between where you are and what you need.
And if you're going to if you do take the option to bring a sitter into your home, still implement the mask. And be sure that anybody new coming into your home always has a mask on, and also implement the hand washing rule. We also want to talk to you guys about traveling, because everybody's like itching to travel. You know, as soon as this COVID is up, I'm going to travel, I'm going to go here, I'm going to go there, which is fine. So in order to go there, we want to kind of tell you, you know, just kind of the same things about being cautious with travel, so you know kind of how to do that. So of course, you know, on the airplane, people say it's not the cleanest place. Sometimes it's clean, sometimes it isn't, but you can be sure your space is clean. So naturally, you wash your hands, you know, keep your hands clean. They have like little Clorox wipes that you can pack in your purse if you can find them. If not, you might have to pack the big box from your house into your purse and check it and carry it on or whatever. You clean off the carry-on table. You clean off the armrest. You clean the whole chair. If you go to the bathroom, take a wipe at the door, open it up, clean the whole area. The cleaner you be, the better options you have. You also want to wash your hands a lot. Now, as far as eating and stuff, you have to be selective. Try to eat in a more open space when the airport, where it's not as many people around, because you have to realize that the plane is closed in. So if you're eating on the plane, you're taking your mask off, that's a little bit more risky. So you want to try to maybe hydrate before, eat a little bit before, eat after. Because COVID, you know, is real. It is happening. People are being impacted by it. But it doesn't mean that life is necessarily over for each person. You just have to move differently with different things.
And the airlines are helping us out, Amber. They're, you know, doing their part too to try to make sure that we stay safe, because if people are getting on their planes infected and getting sick, then we're infecting their staff. So it's in their financial best interest to make sure that they're doing what they can do as well. So, I'm going to be very honest with y'all, because I'm a professional. I'm here to give y'all the real advice, but I'm also a human being with feelings, and I'm a person. My mom and my sister got flued out this weekend. I put them on a plane and I flew them to me because I needed them here. But I also made sure that I gave them a very good briefing before they got on the plane. We talked about a lot of different things. And I also reviewed kind of what Delta's policies were before I had them do that. So first and foremost, make sure that you call the airline and figure out what they're doing in terms of their seating arrangements. Right now, Delta is having their passengers board from the front to the back so that you're not passing people on your way to the seat. They are skipping rows in between people so that there aren't people in any two consecutive rows. And they also have blocked off all of the middle seats so that nobody is sitting next to each other. When you get on the plane, instead of them passing out their drinks in, you know, the normal plastic cups and giving you that ice with that funky water that we don't really know where it came from, they're giving people little travel packs with freshly cleaned blankets that are in sealed bags, individual bottles of water. So they're trying to do their part too. I mean, again, life isn't going to go back to normal right now, but we do have to kind of start trying to ease our way into things, because a big part of this that I don't think people talk about is the mental health aspect. Okay, it can be very depressing and very lonely to just be isolated and alone and not seeing people.
because the mental health part, I think a lot of people forget about for,
Mm-hmm.
you know, healthcare workers and for, you know, everyone that's outside working in different areas. I also think, you know, that's a big part. So people are depressed, you know, people that were depressed before or had mental issues before, it's only getting worse. So it's okay to realize that you have an issue. It's okay to admit that you're struggling. It's okay to reach out and tell someone. They have a lot of hotlines that are available. There are a lot of mental health panels that are also available that are allowing people to kind of voice their opinions and kind of get a little bit of assistance about how to move forward with that and how to get through their issues. Because a dark place doesn't stop, you know, when you're isolated and forced to stay home. So you still have to identify those issues and try to move forward with them the best way you can. So be sure that if you are having those issues, that you do seek the help that you need. They have emotional support hotlines that are out there for people that are having issues and struggling emotionally, physically, on top of the financial support that they're attempting to offer with the government. So just be sure you take advantage of those resources.
I was really saddened over the weekend to hear that one of the medical directors at a large emergency department in New York had committed suicide. And this was one of the hospitals that had been affected by, you know, coronavirus the most. So it's definitely real. It's something that I think we as healthcare workers don't come to terms with sometimes. We're so used to dealing with the physical aspects of the disease that we don't necessarily ignore the mental aspects of it, but it's not at the forefront of our minds. When all of this first started, and you know, I am a very high functioning individual. I'm an emergency department doctor, for goodness sakes. I'm used to functioning in high stress. I wasn't sleeping for weeks straight. I would just be up in the middle of the night tossing and turning, and I didn't feel stressed, and I didn't understand, you know, I'm like, why am I not sleeping? Do I just need to, you know, take some Benadryl and stop watching TV so late? And what is going on with me? I was nervous. I was freaking out. It's okay to say that you're scared and that you're anxious. None of us really know exactly what the future is going to look like. None of us knows what kind of impact this is going to have on us. I'm terrified that every day I go to work, I could potentially contract something that I may bring home to my family. I'm not necessarily worried about me getting sick, but the guilt that I would feel if I passed that to my husband, or, you know, if I passed that to my elderly in-laws or my mom, you know, those are very real thoughts and feelings. Don't feel like you have to keep that stuff in, or like, you know, this isn't that big of a deal. I shouldn't feel stressed about it. It is absolutely a big deal.
And I think too, Regina, the big thing is too, it's hard to process sometimes when so many people around you are being impacted. I know, like, just at my job alone, multiple people have tested positive for it. Some people have been out of work for weeks, and we're not knowing, like, how it's going to play out for them. You know, so that alone is stressful. So I think it's very important too to check on your friends, check on your family.
Yes.
And the big thing with COVID that makes it really tricky when you do have someone that is actually fighting it is the fact that they have to fight alone. That's the big part. There are no visitors. There's no one that's able to really sit there and be with them like it would normally be in an everyday setting in a hospital. So it's a real struggle. So you have to think about that being your dad or your grandma or your best friend or somebody, and you not being able to hold their hand or be there for their last breath, or even be there to encourage and say it's going to be okay. And all you have is a phone. You know, so it's very stressful on the end of the nurses or the end of anybody. You know, you're trying to get information over the phone. You're trying to call the doctors, and you kind of, you know, you feel outside. You know, you don't really know what to do or what to face. And, you know, it's very upsetting and it's very heartbreaking. So just kind of try to think about that. So everybody is dealing with something, and it's very real for different people in different ways.
Yes.
So just really, 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 I can't tell you enough to, like, really get the help you need and try to be there for your friends, because you don't know how dark this place can be for each person.
So before you go to that lit day party this weekend, while outside opens back up again, keep that
think about your
visual
grandma
in your mind.
Yeah, like, think about your grandma, think about your best friend, you know, and just be sure you think about it. That shot might work, but that shot might be bad, and it might be the last one. So think about that, okay? So now we want to talk about, I'm going to let Regina open up. We're talking about, like, when you should actually go to the ER, and then I'm going to talk about, like, what you can do more so with milder symptoms.
So let's go over a little bit about symptoms of COVID-19 and coronavirus. And we'll talk about some distinguishing factors a little bit later in terms of how you can maybe figure out, is this my allergies versus do I potentially have COVID? But I've noticed that there have been quite a few people who are coming into the emergency departments because, you know, maybe they're just scared that they might have contracted it. They maybe went somewhere that they shouldn't have mild symptoms, or they woke up with a little snotty nose and they come in, they're like, oh, doc, check me out, I want to get tested. First and foremost, one of the largest problems with this disease is that we're not testing as much as we should. You would think that if you come into a hospital, you can automatically get tested for coronavirus. That's actually not the case. Every hospital is different, and I do work at some hospitals where you can get tested even if you're being discharged. But the hospital that I work in, if you're not sick enough to get admitted to the hospital, you're not going to get a coronavirus test. That's number one. Number two is, imagine a hospital is where all the sick people go, okay? So you are now funneling yourself into the place where the people are the sickest of the sick and exposing yourself without having the proper protective equipment to who knows what. Aside from COVID, you could be exposed to a lot of other things. So it's actually in your best interest not to come into the hospital unless you really, really have to. What coronavirus does is it essentially changes the architecture of your lungs so that people drown in their own secretions and they aren't able to breathe. One of the most worrisome symptoms of coronavirus is shortness of breath. If you have mild shortness of breath that resolves, if you can have a seat, relax, stop moving around so much, you probably don't need to come into the emergency department. If you're having severe chest pain or you cannot catch your breath, that's when you need to go ahead and come into the emergency department. The way that we treat this, there is no treatment. Okay, we basically do supportive care. So if you have a fever, we give you medicine for your fever. If you're dehydrated, we'll give you fluids. If your muscle hurts, we'll give you medicine for pain. But there is no specific treatment that has been designed for coronavirus just yet. There are things that are being studied and tested, but nothing that is proven to work just yet. So all we're going to do is support your symptoms, and if you have respiratory issues that are so severe, then we'll start putting you on some specialized equipment to kind of help you breathe a little bit.
So to kind of piggyback on what Tina said, when you have mild symptoms, doctors' offices or primary physicians' offices have actually implemented things like telemedicine, you know, where you can kind of do virtual appointments with them and they can kind of assess you kind of over the camera and just kind of see like if it's severe enough for you to go. Now, if you are completely short of breath, do not video call your doctor. Okay, but if their symptoms are mild, they can kind of check you out over the phone, see what's going on. If you have to go in your doctor's office, some doctor's offices are doing separation. So they're separating you from people that are coming in for wellness checks, and people that have symptoms or could potentially have the symptoms are being separated into a different area. So the screening process and everything is being implemented to try to protect everyone that's involved in the situation. So you want to be sure that you take advantage of those things. Also, other emergencies are still happening. So people are having heart attacks and things like that. And you don't have to be afraid to go to the doctor if you are having other things going on. You don't have to omit those things because of the COVID situation. Also with the testing, you know, they're trying to expand sites for testing, but it's not the easiest thing to get done. But if you have a question, be sure you contact your doctor. Use your patient portal. You know, if you have mild symptoms, manage them at home. But if it gets to a point where you're confused or you're just missing something, you just have a question, be sure to reach out to your healthcare provider. They have a lot of different ways in which they can be contacted, so you want to utilize that.
So I just saw a comment. Mia just said that the news has made us into hypochondriacs. It has.
And everything's changing every day.
Everything is changing every day, but I have seen a lot of people who kind of don't believe what the news is saying. And like I mentioned earlier, people are saying that this is propaganda and it's not real. I cannot stress to you guys enough, and I don't want to turn into a science nerd on here and start really going down into pathophysiology, but coronavirus is such an infectious disease. The fact that we have 1 million cases in the United States and we're not even testing as much as we should makes me really, really worried in terms of what the actual numbers are, okay? That virus has a very high affinity for certain receptors in your body. So that basically means once it gets in there, it's going to latch on and you're going to have the disease. The other thing is you can be asymptomatic and not have any symptoms for up to 2 weeks. So you're walking around, you know, living your life, infecting people right and left for 2 weeks. You get sick. In that 2 week span of time, you could have infected hundreds of other people. That's why this disease is such a big deal. In the United States alone, as I mentioned earlier, we have 1 million cases and almost 60,000 deaths. I think we were at 58,000 plus yesterday. That's a 6% death rate. Okay, if you're a math person, 6% is not a big number. If you are a physician, 6% is huge. Okay, that is what, 1 out of every 12 people that gets this is going to die. Y'all, this is serious.
It's not like based on conspiracy theories and stuff like that, but it is very confusing with the news changing every day. And so it's just very important to keep the guidelines implemented. Just, we can't say it enough, just play it safe until you like try to be a little bit certain. Okay, it's more comfortable trying to be safe, do the best that you can. That's really all you can do, you know. So just be sure you keep your hands washed. For people who just came on, disinfect surfaces. The 6 feet is important. Stay 6 feet away from people because that is a really, really big part. Wear masks. Masks aren't cool. Masks don't always look good and they might not go with your outfit, but they're very protective against things coming to you, and it's protecting you from giving it to others. So that's just our big thing.
So I see Ruthie just mentioned that they have people in the Cayman Islands that are testing positive up to a month after exposure. Absolutely. Absolutely. My particular hospital has implemented a strategy for healthcare workers. If you test positive, you have to test negative twice before you can come back to work. And for one person that tested positive, it took them 6 weeks before they tested negative again. So that is 100% facts. I see some questions in here about herd immunity. Can that work? Herd immunity absolutely can work. That's basically the way that a lot of other pandemics have kind of died down and were able to fizzle out. But a big part of herd immunity is having a vaccine. So let's go back and talk a little bit about what herd immunity is, okay? And herd, I want you to imagine a herd of cattle, okay? If you have a group or a population that is afflicted by a certain condition, herd immunity basically means that enough of that population is immune to the disease that they protect the people who are not immune to the disease. So to put it in real life terms, you know, I'm having a house party and the people in my house party, 70% of them have herd immunity, okay? So that one person that has coronavirus, 70% of the people they encounter are not going to get the disease. So they can't pass it on to other people that are susceptible. But again, herd immunity requires 2 things. It requires people being exposed to the disease so they can naturally develop immunity, and it requires a vaccine so that we can artificially give you immunity to this thing. We, 1, don't have a vaccine, and 2, we need to stay away from each other because we're not even sure if once you catch coronavirus, you're immune from catching it again. There have been case reports in South Korea of people who were infected, tested negative, and then later tested positive again. So herd immunity is something that would definitely be beneficial to us, but it's way, way, way down the line. I believe in Switzerland, they tried to implement a strategy where if you look up Switzerland, they're not social distancing. They are allowing restaurants to be open, parks to be open, businesses kind of running as usual, and they're just seeing what happens. But their death rate is at like 10%. So I don't really think whatever they're doing is working. Now, granted, they have a much smaller population, but if you have 50,000 cases and 5,000 people have died versus, you know, the smaller countries around you, Finland, Norway, are at a death percent of maybe 2, that's telling you that, hey, this social distancing thing, it probably works, and we need to kind of keep that going until we get a vaccine out here.
Right. They were asking us about recommendations for pregnant women, and I would just say, you know, as much as you can, stay away from people. wear a mask wherever you go, keep your hands clean, but social distancing is very important for you. And you don't have to isolate, but you want to be very selective of where you go and who you're around, because that can have a really large impact on you as well as the child you're trying to carry.
So people are asking about pregnant women, and I think I misspoke. Thanks, Joe. It was Sweden, not Switzerland, that's just out here doing whatever. People are asking about pregnant women and how pregnant women can protect themselves, any advice for them. Pregnant women are a special population, and we always kind of hold them in high regard, because it's not just the mom that's your patient. You actually have two patients, mom and her unborn child. There was a case in New York, of course, of a pregnant woman that tested positive for COVID. And when her baby was born, the baby also tested positive for COVID. So I think pregnant women have to realize that being pregnant functionally compromises your immune system and puts you in that higher risk category. If you catch an infection, any infection during pregnancy, it puts you at risk for preterm labor. It puts you at risk for pregnancy complications. So you ladies have to be especially careful. If you don't have to leave the house, honestly, and you're pregnant, I would suggest staying home. The other thing to think about, those of you who are close to due dates and close to delivering, hospitals are trying their best to make sure that you're not alone during that time, and you can at least have one visitor come in into the birthing room with you. But when it's time to go home, you have to remember that you have a brand new baby that has 0.001 T cells, immune cells. Your baby is so at risk to catching anything. You guys have to be really, really careful. If there's anyone in your house that is being careless, you might want to consider, when you come home with your new baby, self-quarantining to a separate area of the house or a separate room in the house where nobody comes in and out, so that you're making sure to keep your baby safe.
And you have anything else you want to discuss, Regina? They asked about if you're seeing kids hospitalized for COVID in the hospital.
To be honest, not really. Kids are doing pretty well. There have been some pediatric deaths. I work at a couple different hospitals, and then again, I work in the medical center. So we did hear about 2 cases of children that were on ventilators in the ICU, but luckily they recovered. Kids are seeming to do really well with this disease. We actually just had our first pediatric death from COVID, I want to say a week and a half ago, and that was in Detroit. It was a 5-year-old girl, and both of her parents are frontline workers. One of them, I believe, is a firefighter, and another is a nurse. So she probably contracted the disease from her parents, who may have been asymptomatic, and unfortunately she got very sick. But luckily, kids seem to be faring pretty well with this pandemic right now.
I think that, did you have anything else we need to cover, Regina? Look at
Miss Dara T is asking about
traveling. So we were saying that, the airplane companies are doing their part to trying to keep us safe because of the liability for them. But what we suggested was cleaning your areas, that, your tray tables, your seats, your armrests, like being clean when you go to the restroom, holding the door handle with a napkin or a cleaning wipe, and wearing your mask on the plane. We also talked about trying to schedule your eating and stuff prior to getting on the plane, so that you don't have to take your mask off so many times and potentially be exposed.
Yes. And remember, y'all, this live is going to be saved, so you can always come back. If you joined us a little late, you can always come back to God's Favorite Homegirl. The live is going to be saved on her page for the next 24 hours, and we'll try to see if we can figure out another way to have it saved and posted for longer than that. But at least for the next 24 hours, you can see what we discussed during the beginning of the live if you missed anything.
Shelly asked if there was a hotline. Shelly, there is a hotline for questions and answers. Like each state, whatever, has a hotline. They have the emotional support hotline, and then they have the COVID hotline that people can use for questions if they want to have questions about testing or just questions about symptoms or any questions COVID related in general. They do have hotlines available that people can call for help. And I also was telling people that if they had any issues that they should like reach out to their physician, like in the patient portal, because they're prepared and they're willing to answer your questions. And you could also use the telemed option to like video chat them and like ask questions for stuff like that.
Ooh, I'm seeing some good questions. Hold on one second. Okay, so Shelly asked about people not being seen for their symptoms if it's not COVID. Now, again, I have a little bit of a different perspective because I'm an emergency medicine physician, and we are bound by certain laws. There's a law called EMTALA, the Emergency Medicine Accountability some Act. Basically, that means if you walk into an emergency department, you have to be seen by a licensed provider. They can't turn you away at the door, no matter how well you are. Even if you say, there's nothing wrong with me, I just felt like getting weighed today, I want to get checked in. You have to get checked in, and you have to be seen by a licensed provider. If that is not happening, that's a big problem. And you guys can reach out to me on the back end so we can discuss cases individually if you have particular questions. But everybody should be getting seen. Now, what may not be happening is that, sometimes people come to the hospital or to the clinic with certain expectations, and we can't always fix everything in the emergency department. Okay, so if you are well, if they check your heart rate and they check your blood pressure and they see how good your oxygen is, you're young, you're healthy, x-rays look negative, your breath sound good, we probably will discharge you. We may not give you any prescriptions, but that's because we think that you're going to fare well when you go home. Now, the clinics are a little bit of a different story because with this stay-at-home order, clinics are being extra cautious to make sure that they aren't introducing certain things into their clinic space and to their staff and to their well patients. So they definitely may potentially say, okay, well, if you have these symptoms, you're not allowed to be seen in clinic today. And if you feel very sick, then you should go to the emergency department. But if you go to a hospital, if you go to an emergency department, you cannot be turned away without being seen by a licensed provider.
Regina, in the hospital, are you seeing African Americans present with different symptoms?
Oh, let's talk about that.
There's an article floating around where they're saying that, they're not having a fever. Some of them are not presenting with shortness of breath, but some of them are like just extremely tired, or some of them are extremely tired and have a lot of shortness of breath. So can you just tell what you see?
I wouldn't say that African Americans specifically present with different symptoms because, and I tell my residents and my trainees this all the time, patients don't read the textbook. Right. We can say all day, this is how coronavirus presents, this is what it's supposed to do, but everyone can have a different manifestation of the disease. Some people don't have a fever. Some people don't have shortness of breath. I know one person, she had absolutely no symptoms. It was just a fever. I know someone else that had no symptoms other than a cough that wasn't even productive. So everyone presents a little bit differently. What we aren't talking about, though, is the disparity in terms of how many African Americans are dying from COVID-19 as compared to what the populations look like, okay? So in New Orleans, for example, or excuse me, Louisiana, African Americans, I believe, make up about 32% of the population, yet they are 70% of deaths from COVID-19. 70% of deaths, yet they are only making up 30% of the population. And why is that? One, it's because a lot of African Americans, older African Americans, have chronic illnesses such as hypertension, diabetes, heart disease, that may not be as well controlled. Two, a lot of times in our communities, we tend to minimize. We've talked about people not taking things as seriously, people still having gatherings, people still having house parties, which puts you at further risk. And then, there's just the general healthcare disparity towards African Americans in general. Before COVID-19 popped up, African Americans were facing disparities in terms of healthcare. There are multitudes of papers on it, and if you try to tell me that it doesn't exist, then we can talk about that on a different live on a different day, okay? Because I can talk about that all day long. African Americans get less pain medicine. They are sent home more often when they have serious illnesses. There are a lot of things that factor into that. So that's another reason why I'm so thankful to God's favorite homegirl for sponsoring this live and for asking us to come on here to educate ourselves. Because like I said at the beginning, if you didn't hear it, I'll say it again, it's us or else. If we don't teach each other and if we don't hold each other accountable and hold each other up, no one else is looking out for us.
So let's see if we had any more questions. I think that is it.
For the business owners, when should we consider opening? Ooh,
We
that's
were
a
talking
rough
about
one.
that and kind of deciding on your own, because we
Yeah.
can't really tell you like, what's really happening in your household. So earlier we were just talking about how, if you absolutely have to open your business or if you have to go back to work, you just have to be safe about how you do that. You want to be sure that your employees are safe so that they don't take anything back to their family. So it still goes back to following those guidelines. And maybe if you have a restaurant, maybe consider a different seating chart. If you have a lot of employees, be sure they all have masks. Be sure that everybody is actually really washing their hands. Be sure you have soap in the bathrooms if you have a restaurant. Be sure things don't run out. Just kind of implementing the guidelines in a way that it can tailor to your business will probably be more beneficial to you. But if you have to open your business, we can't tell you yes or no whether or not to do that. Just can kind of tell you how to be clean and try to be as safe as possible doing it.
Mm-hmm. Someone else asked
about retesting.
Does the mask affect the intake of oxygen? Masks do not affect the intake of oxygen. They filter particles that are a lot smaller than what the size of an oxygen particle is. So a lot of times people will put on a mask and they'll say, oh, it's hard for me to breathe. It's hard for me to breathe. That's more often because you're covering your nose and your mouth and you're covering the places that you intake air, but it doesn't affect the intake of oxygen at all. If you are wearing one of those N95 respirators, they pinch right here on your nose. So if you're having a hard time breathing, you can loosen that up a little bit. The surgical masks are a lot more forgiving. They're a lot looser. So you can kind of just pull at the chin a little bit to give yourself some leeway between your face if you feel like you're having a hard time breathing. But you definitely won't have any effect on the amount of oxygen that you get.
So I think we got time for like maybe 2 more questions. And then let's see, they asked about retesting. How many days are you retested, or when you're retested after testing positive?
So you don't have to get retested. There are different strategies to determine when you are officially over COVID-19. The CDC actually just released new guidelines last week. One of the strategies is a retesting strategy. So if you test positive after 10 days, you get retested. But the problem with that is, for a physician, just because you test positive a subsequent time, that doesn't necessarily tell me that you're infectious. You could still have the viral antibodies in your system floating around because you've been exposed to it, but that doesn't necessarily mean you're sick. It doesn't mean that you're infectious. Another strategy that they're using is a symptom strategy. So basically, if you've been able to go 3 days with no fever, without using any Advil, Tylenol, ibuprofen, and 7 days from the last time you had symptoms, then you're essentially cleared without having to be retested. So unless you work in healthcare or in a particular field that's mandating that you have to be retested, you don't necessarily have to go do it again. And for those of you who don't know about the COVID-19 test, it's called a nasopharyngeal swab. That means they put something that's smaller than this, probably the size of a Q-tip, and stick it all the way back through your nose. It's not fun to get tested once, much less get tested twice. So don't do it unless you have to. How do you handle being asymptomatic but testing positive? Does that person eventually get sick? No, that person doesn't always eventually get sick. We mentioned at the beginning of the live that there are studies showing that 30 to 40% of people with coronavirus are asymptomatic and remain asymptomatic the entire duration of their illness. But if you are asymptomatic, you went to get tested and you test positive, now it's time for you to be a good steward and for you to be philanthropic and for you to think outside of yourself and think about the other people that you're potentially exposing and potentially putting at risk. If you test positive, it's extremely important to make sure that you self-quarantine as much as possible. Okay, for some people, you may live alone. You may not have anyone to be able to go get you groceries and things like that. So that may not be possible. If it is possible, please do it. And if you have to leave the house, wear a mask.
Wear a mask, wash those hands, wash those
Yes.
hands again, wash those hands again. Stop wearing those gloves, please. Stop wearing those gloves, please. And stop having parties, okay? No more block parties. Just really wait till outside is really safe, and just be inside if you can be. If you have to be outside, please be safe.
So you're not going to brunch this weekend, Amber?
No, ma'am, unless it's virtual. Like to have brunch with me over the phone.
We're going to have a virtual brunch.
And just because the governor opens it up does not mean you have to go. You know, you just make your own decisions and your choices based on where you're at. And just be careful. Once again, we want to thank Shelly and God's favorite homegirl for having us tonight. And we thank you guys for tuning in. We hope that this is very informative and helpful, and that you can take something back, you know, to your friends or your family. Once again, this will be posted at a later date so that if you came in late, you'll be able to watch the whole thing. Anything else you want to say?
They are asking, I think we have maybe 5 more minutes. They're asking about supplements and vitamins. Now, I believe in taking supplements and vitamins. I take my vitamins every single day. There is no scientific evidence that any of those things can prevent you from contracting any disease. However, being in your best physical, mental, and emotional health actually does provide protection against disease. So, you know, whatever floats your boat. Like I said, I take my vitamins. There's no science behind it, but there's nothing really harmful in it either.
Right. There's nothing going against it.
Do y'all have any last minute questions before we hop off? I like talking to y'all. This has been really fun.
Such a good audience.
I know. Stop wearing gloves. Yes, Ruthie. We went in on the people wearing gloves in public.
Please don't wear them. Just wash your hands.
Gloves.
Okay? They have baths.
Wash your hands.
Sanitizers. Find some soaps and sanitizers, something. But don't wear the gloves. Y'all, please be sure to go to Shelly's page, God's favorite homegirl, and get your cute shirt.
The tip tee.
The tip tee is very comfortable. It's also very cute. You can wear it with whatever you like and be super comfy.
Before we leave, I just want to kind of bring it in a little bit. For those of you, I've seen a lot of people. I think Lauren says she called back to work on Monday. I see some other people in here who work in clinics. My mom and my aunts, they are praying women. And when I say praying, I mean my mom has her rosary hanging on the side of the bed and she gets on her knees and prays every day. And I believe that's a big reason in terms of why I'm so covered. Before I go to work every day, I read Psalms 91. It calms me. It gives me a sense of strength before I go into work. So for those of you who are feeling a little bit anxious about having to re-enter the workforce, just think about Psalms 91. And for those of you who are in states that are reopening, I just want to remind you guys about the story of Noah and the ark. Okay, Noah got in the ark. God sent the flood. When the flood was over, Noah didn't open the door and rush out of the ark, y'all. He sent the dove to see if it was safe, okay? And the first time he sent the dove came back and said, not yet. And he sent the dove again, and he kept doing it until the dove came back with a little olive branch and said, okay, it's cool now. We can go out. The people that are going out this weekend are the doves.
The ones
I'm Noah. I'm staying home. I'm staying home.
I think that's it, maybe.
All right. Thank y'all so much for joining us. If there are other topics that y'all want to talk about, please make sure you add us at God's Favorite Homegirl, and we'll see if we can do this again sometimes. Love you guys.